I just performed a vertical restore facelift on my wife, Netta, and you guys are going to see everything from the day of surgery all the way through the first few weeks of recovery.
When you're older and your face starts melting off and you look angry and tired all the time, people react to your micro expressions without even realizing, thinking, danger, danger, this woman's mean. I was getting a lot of really bad reactions from people and bosses. Everybody asking me, why are you so tired? What's wrong? Why are you so angry? Nothing. I was having a great day until you said that.
I would say that the facelift procedure is the single best procedure to rejuvenate the face, to make the face look more refreshed, to make it look younger.
Good morning, we're getting ready to do your surgery, so tell me how you're feeling.
Super excited.
Awesome.
I'm ready to tighten this up.
Yep.
How do you feel about your husband doing surgery on you?
This is Netta. I hate pictures of myself. My girlfriends think I'm crazy for doing it. Only a few are supportive.
We're now 11 days after your facelift. Tell me how it went.
Went great. No pain, sore, but easy healing. Wasn't bad at all.
Now, before we get into this video, let this be your disclaimer. This video is for educational purposes only. I am not a medical professional, nor have I ever claimed to be. The stuff that we're going to be discussing in this video is very graphic, not only discussing, but actually seeing. So be warned, let this be your warning. If you are the squeamish type, this may not be the content for you, so consider this a cue for you to click off immediately. No hard feelings. I will see you guys on the next video. Also, this video is not here to convince you to get a facelift or to make you feel bad about how you look. Spoiler alert, if you did not know, with so many videos that I have done, I would not consider any of these procedures. What's that saying? I wouldn't touch it even if I had a 10-foot pole. That is me, all right? I am just interested, curious, and want to educate myself as well as y'all. And if you are a doctor and you have some other insights that I may miss, please feel free to comment them down in the comment section below, because like I said, I'm not a medical professional. So let's continue. The more I think about it, facelifts are just for people who want to turn back time, but it is easier said than done. As I was face planning into this research, I realized there are so many different flavors of facelifts. There are ponytail facelifts, mid facelifts, full facelifts, and then there is the big boys, the deep plane facelift. I thought when somebody said they want to get a facelift, it just meant their entire face, but boy was I wrong. The best way I can put it is think of it like you're ordering coffee. You've got the light, you've got the medium, you've got the strong, and then you've got the extra strong. It all depends on what the heck you want. The only difference is you're not getting a caffeine buzz. Instead, you're getting your face yanked in all sorts of directions, literally.
A patient asked me today if 43 is too young for a facelift, and my answer is always the same. There's no real chronological number where you're a candidate for a facelift or not. So there are patients in their late 30s where they do have laxity and are good candidates for a facelift. That could be due to genetic factors, that could be due to their anatomy, that could be due to lifestyle factors, sun exposure. There are a lot of different reasons why someone could be a candidate as young as their late 30s. And then there are other patients who may not be a candidate until they're in their 50s, similarly because of different factors that are involved. So I never use a hard and fast numerologic rule, but it has to do with how your tissues appear and how they look. I will say that for the most part, results always tend to look better and tend to last longer when you were younger. And usually a premenopausal lift will age better than a postmenopausal lift. So if you do your facelift before you go through menopause, your hormone levels are better, you're at a state where you can stimulate more collagen, more elastin, as opposed to after you go through menopause. So oftentimes the results look better when you have them, if you have the surgery performed prior to going through menopause, and I think the results look better and they last longer. So a couple of reasons for doing it when you're younger than when you're older, but not everyone is a candidate for a lift at 43. Some people aren't a candidate when they're 53, but there are definitely patients who on an individual basis I would assess and could be a candidate for a facelift in their early 40s for sure.
Now, like I said before, I would never consider this. However, it is very interesting how young you can actually get a facelift. People go through a lot of things and there are a number of reasons, but don't let society be the main reason why you change your face. I don't know whether it's because I'm already in my mid-20s, but early 40s sounds really young in my own opinion. Early 50s even sounds crazy, but then again, maybe it's just my bias. Before we get into the second video, please take note that the video before this was not contradicting the video you're about to watch right now. Instead, the lady in the beginning, the doctor in the beginning actually was mentioning that you get better results before you hit menopause. However, this lady's about to talk about how getting it before is crazy. So let's get into it.
If you are thinking about getting a facelift, I had a virtual consult with a plastic surgeon yesterday, and I want to share 3 things that I really didn't know before but seem sort of obvious now. Number 1, he asked me if I was in menopause. Now, I'm 49 and I am not in menopause, and when I said no, he was a little incredulous actually. And I was like, okay, Dr. Kim, I'm not 59, I'm 49. Like, a lot of women are not in menopause at 49. And he said to me that a lot of women actually are now, that the trend has been younger and younger. The reason why this is important is because he said there are 2 events in a woman's life in which she will rapidly age. One is pregnancy and the other is menopause. So he asked me, did I want to wait until after menopause for me to have the facelift, because I would potentially have the facelift now. I could go into menopause tomorrow, right? And then I would see, probably more laxity and issues that I may want to address. And so I may not be completely happy for a very long time after having this facelift. I was disappointed in the consultation to learn that I will absolutely have a scar. There is no way around it. So this is a big concern of mine. And he said, even though they're going to cut in here, go around my ear and then back to my neck, like, being a person of color, I will have a scar. And I just need to be prepared for that if I'm going to have the surgery. That he said if I was sitting across from someone, that person would not be able to tell. But as they got within like 6 inches of me, they would be able to see it. For girlies of color, the question I always phrase to myself is like, okay, do I want saggy skin or do I want a scar? Choose your struggle. We also talked about anesthesia, and I'm somebody who really just doesn't want to have general. I would like to have local, and there are plastic surgeons who will do a facelift with local anesthesia. And he said he could do it, but here's a point that he made. When you get just local anesthesia, they're gonna have to numb you everywhere with a million shots, right? And all of that fluid is going to cause more swelling. And so the facelift is just not going to be as accurate, I guess is the only word I can think of right now, as if they just did general. Yes, you will still have numbing, around your face, but not nearly as much. And so you're just not going to have as much swelling.
Choosing to go the local anesthetic way when it comes to facelift is crazy work. You are the toughest of the tough, because I have no words. I have no words. Now, the video was extremely long, but I tried to chop it up as much as I can to where it still made sense, all right? We get all the important parts out. Now, the next video we're about to watch, like I said, everything here is going to be graphic, so be warned.
Videos for those of you who want to see what goes on behind the scenes of a facelift surgery. If you get grossed out by surgical videos or graphic videos, please keep scrolling. So this is one part of the facelift surgery that I think is really critical to the final result. This is called defatting the skin. This is me doing a facelift surgery. I'm actually removing some of the fat from the skin right in front of the ear. The reason this is important is if you notice the skin right in front of the ear is actually pretty thin. When we're doing a facelift, we're often moving this tissue all the way back here. That tissue tends to be thicker, so it's not always a good skin match. So if you don't take that extra step to thin out that skin and defat it, then that will kind of give away that something was done. It won't look natural when someone sees the patient from the side view or even from the front view. So as a surgeon, it's really important that we pay attention to these fine details so that our results look as natural and as imperceptible as possible.
I'm not gonna lie, this was both fascinating and terrifying all at the same time, and science has definitely evolved to the point where we can literally tighten up our own skin, smooth out the wrinkles, and pretty much hit the refresh button on our faces. Now, on one hand, it is amazing, ? We have come a long way from just splashing cold water on our faces and hoping for the best. But on the other hand, it's kind of scary because we're talking about our face, our literal face, having your actual face cut up, pulled, and stitched back together. It's insane. To think I was the same person that was giving y'all a disclaimer and I'm over here tripping. I need to recover. Now, as I mentioned before, there are different types of flavors when it comes to this face game, so let us kick it off with the ponytail facelift. Y'all know exactly what I'm talking about. When you throw your head in a ponytail and suddenly your eyebrows are higher and your eyes are smaller and your cheeks are a little plumper, you've got that instant facelift effect. And should I put my hair in a ponytail? I'm not gonna put, y'all have put y'all's hair in a ponytail and y'all know it gives that like that. This look right here. It's actually prettier than I'm doing, but you guys get the idea. Okay, now I just look scary. The ponytail procedure pretty much mimics just this that I'm doing right now, minus the temporary tension headaches and minus the craziness. I'm holding it in, but put your hair in a ponytail and you'll know what I'm talking about. And when it comes to this procedure, it is a minimally invasive option that targets the upper part of your face. So think your eyes, your brows, as well as your cheeks. So the surgeon pretty much makes tiny little hidden incisions on your hairline and lifts everything up just a little bit. It is very subtle, very natural looking. It will not make you look like you are always surprised or even a different person. Now, before we move on any further, let's get into 2 videos.
I'm 61 years old. I'm having a facelift in 3 days. I posted a video this morning kind of about the preoperative stuff that I'm doing to get ready for that. And a couple people wanted to talk about the cost. And I totally get that. Like, why wouldn't you be curious? First of all, I want to say I recognize, and it's really important for me to acknowledge what an incredible place of privilege this is that I live in, that I get to do this. Because it is an expensive surgery, it's an elective surgery, it's obviously a cosmetic surgery. This is not anything that anybody needs. I'm paying for the whole thing out of pocket. The total cost is about $45,000. That includes all my preoperative care, 1 night stay at their medical recovery center, and then all the postoperative care. The only things that my insurance paid for were a preoperative medical exam, and I had to have an eye exam, and that too was covered.
She looks really good for 61, and I will assume that she has had Botox done. Regardless, she looks fabulous. $45K is what she paid. I think that is minus like the plane and everything. However, take note that it differs from state to state, doctor to doctor, all right? So don't take the $45K and run with the wind. Be mindful that it is different for every single person.
So I just thought I'd do a little video to chat about the full facelift that I had at the age of 39. And a lot of people were saying to me, Gemma, you don't need a facelift, you're too young. And I just wanted to chat about why I wanted one at this age. And everyone's going to be different, obviously, and everyone's going to have their own opinions and things like that. So for me, I am 39 years old. I'm going to be 40 in September. And the job that I do, I take pictures for a living. I'm a content creator and I've had this job since I was 18 years old. So it's the only job I've ever had. And you know, I'm still going strong and I'm very grateful to still be in an industry that is full of younger women and younger girls, and the fact that I'm still going, I'm extremely proud of that. So for me, the reasons why I wanted a facelift is because I think at the age that I am now, I am just coming into my prime, and why wouldn't I have a facelift to extend my youthfulness and, you know, just feeling a bit more fresh-faced a little bit longer while I still feel that I'm in my prime. A lot of people have said to me, Gemma, you should wait till you're 60. Now, why would I wait another 20 years to age, look older, look haggard, look tired? Why would I let myself age for 20 more years and then have a full facelift at the age of 60, for then at 60 to look amazing again? To me, that doesn't make sense. So that was the reasons that I decided to have a facelift at 39, on the cusp of 40. It was for my 40th birthday present. So yeah, like, I'm obviously still healing. I'm 5 weeks post-op today, and I mean, I look almost back to normal. I'm still swollen, I'm still numb, which is expected, and you know, I'm excited for it to fully settle and for me to, you know, I know my own face, and if someone was to see me who didn't know me, they probably would never even be able to tell that I've had a facelift, which is also the look that I wanted. Apart from the scarring, obviously, but over time that's going to go down as well, and I'm using scar creams daily. I've been sent some products, actually. I'll do a video and talk about those as well. And you know, I'm just excited for the healing process and for it to look even better over time. So if anyone, you know, is my age and they're thinking about having a facelift, I just think, you know what, you have one life, do whatever makes you happy.
If there's anything in the world that will snitch on me, it is my face, because my mouth will save me. My tongue will definitely save me, but my face, it is my biggest hater. It is the snitch. You guys saw my reaction when she said prime. Now, I have an explanation for that. I thought your prime was your 20s and 30s. Now, it doesn't really matter, but it caught me off guard. One other thing she said is, you only have one life, so why not do what makes you happy? And let's just put this topic aside. I personally think that that line can be very dangerous at times. And then bringing it back to this topic, you do only have one life, and there are some complications just like any other surgery. So do you want to risk it doing this with the one life that you do have before you potentially have eternal life? That's just my take on that. And yeah, I'm just thinking about how my face is a snitch. I can't change it too. I mean, I could with Botox and facelift, but I'm not gonna do it. Let's continue. Now we're gonna get into mid-facelift. This one is all about the middle third of your face, specifically your cheeks and the area of your nose. If you feel like your cheeks are starting to deflate, only if you feel like it. Don't let society rule, all right? And those lines from your nose to your mouth are getting a little deeper. This is what this facelift is for.
So why do I like a mid-facelift? Well, a mid-facelift is actually a procedure that can be used for younger patients that are experiencing early facial aging. It's really a procedure to reposition your cheeks and elevate them. And by doing so, you can create a rejuvenated look and avoid a more extensive facelift with bigger incisions.
Now, the recovery time for this procedure is very moderate. Why am I'm touching my face because it's facelift. That's why I'm touching my face so much. I did wash my hands, so it's okay. But the recovery time is pretty moderate. You'll be back to your normal self within a couple of weeks. Next up, we have the full facelift. Now, this is the one you've probably heard of because I have as well. And if I'm being awkward in this video, is because I am just shook. Now, I'll go ahead and assume that a lot of us have heard of this procedure, and that is because it is the go-to procedure for people who are seeing serious signs of aging, saggy skin, deep wrinkles, and the dreaded loss of their jawline definition. It pretty much tackles the lower 2/3 of your face, including your neck. So the surgeon makes incisions once again around your hairline, your temples, and behind your ears, then pulls everything back into place, as you guys saw in the first video, I believe, that I showed you guys, trimming off the excess skin. I like to think of it as the ultimate facial renovation, but with greater power comes great recovery time. You're looking at several weeks of swelling, bruising, and feeling like you've been hit by a very precise but very expensive bust. But once all that subsides, you'll have a smoother, tighter, and more defined look that is meant to last for years. Now, before we get into the final boss, the big boys, what I like to call the Rolls Royce of procedures, we're gonna watch 2 videos of debunking being made. Now, the first one, I may cut it short and I will explain exactly why, and then the second one was very interesting.
Signs to consider when getting a facelift. Many people think it's age-related. However, you can get a facelift as early as 25 if you see these signs. Oftentimes it's genetic-related when you're younger, but when you start to see some jowling...
I'm sure you guys are thinking, the video just started, what are you doing? Listen, I said I would stop the video. Now I will play it in its entirety, but I cannot fathom the fact that she just said you could get a surgery as early as 25. Now, obviously not everybody is going to be a good candidate for this. However, she goes on to name and list all the signs that you may see. Listen, like I said in my disclaimer, I just have to say it again, okay? Let me reiterate. Don't do this procedure unless it is something you genuinely want to do. And also, do not let society be the determining factor for why you have a procedure. And also, this is a doctor, all right? She is a doctor, and she'll be telling you guys what to look out for. Don't start going to the mirror and trying to find these things and everything. Just love the skin you're in. Love the skin you were blessed to have, all right?
Here, so jowls are when it's no longer a straight line along from the jawbone to the chin. You'll start to see some pouching here. You'll also notice some laxity here. That's the first sign. The second sign would be when you start to see your cheeks start to drop down, which causes deepening of this crease, which is called the nasolabial fold. Third, a kind of subtle sign that you might see is you'll start to notice a little crease formation right by the tragus, which is right in front of this cartilaginous portion of the ear. When you start to see that, you can consider going to see a plastic surgeon.
I don't want to spoil the next video, so let's just get into it.
If you're in your 30s and already thinking about getting a facelift, let me stop you before you make the worst decision of your life.
No hate to Dr. Idris. Big fan here, actually. Let's just maybe clarify a few points of confusion.
And if a facelift has a 8 to 10 year lifespan, which by the way, you still need to maintain, if you do it at 35, hypothetically, are you going to do it at 45, 55, and then 65? What the hell are you going to look like by the time you hit 70? You only have so much skin, number one. But each time you get a facelift, your face is going to shrink. They take out some of that tissue underneath.
This is where the clarification comes in. A deep plane facelift, which is what most surgeons are doing nowadays, does not actually remove much tissue. So your face is not going to shrink. All the work is done underneath the muscle where the ligaments are released and a small bit of excess skin is removed, but again, not that much. And saying that a facelift lasts 8 to 10 years is a little deceptive because even 20 years from now, if you get one facelift, you will still look better having had it done than not.
Trust when I say, doing it too early and with the wrong person will be the worst mistake of your life because you only have one chance to do it.
Of course, you should go to the right surgeon. I definitely agree with that point, but that goes for any procedure that you're going to have or you'll regret it. But you don't just have one chance to do this. Your face is not going to shrink. It really just has to align with what your goals are at that point in your life. Point of clarification, I am not convincing anyone in their 30s or their 60s for that matter to do surgery. Your anatomy and your aesthetic goals are really what's going to dictate what's right for you. So if you've got a lax neck and jowls and you're in your late 30s, but you want a non-surgical treatment to give you a sharp neck and jawline, that procedure does not exist. It is a face and neck lift. The age at which you decide to do this, though, that's on you. And so you could choose to do it earlier and have more time to enjoy it, or choose to do it later and maybe only do it once. But I think these points need to be clarified because the age at which a facelift is done is one of the most common questions, and there's a lot of confusion about it.
I 110% agree with what he said. The lady was a little too hype. I know I can get hype, but she was a little too hype. The goal is not to make you fearful. The goal is not to scare you. And the goal is also not to get you to go under the knife. One of my main issues is hearing the words facelift and 20s. That is a no-go zone for me. Finally, we are talking about the big boy, the deep plane facelift. This one is for people who just want to go all out. Unlike the other facelifts, can you stop? That mainly focus on skin and fat, the deep plane facelift gets into the nitty-gritty by repositioning the deeper layers of the muscle and tissue, as the guy had mentioned. The surgeon works underneath the SMAS layer, and I'll put a picture for you guys somewhere over here, but it is pretty much a fancy word for saying the muscle and tissue layer under your skin. The recovery is on par with the full facelift, so you'll need to be very, very patient, but the results are often worth it. As some people have said, Think of it, like I said, as the Rolls Royce of all the facelifts. This is the big boy, the big boss. Let's get into some videos.
Good morning from Mexico. I'm on day 4 of having my neck and facelift in Mexico. So just wanted to provide a quick update and try to answer as many questions as possible. So let's just jump right in. Some of the questions y'all been asking. I am 41 years old. My pain level. Pain has not been bad at all. I know it looks like it's painful, but it's really not. The first 2 days I took Cordylac. After that, I've just been doing Tylenol 750 milligram. Cost was around $15,000. That does not include flight or food or any additional meds. Additional meds being things like arnica, some sleeping stuff to help me sleep, stuff like that. I think I've spent a total of maybe $200 on additional meds, and those are things like even like scar tape, things like that. I use Dr. Fabian Mendoza. He's under the EOC umbrella here in Mexico. You can easily find him on Facebook or on TikTok. Do I have drains? Yes, I had 3 drains, 1 coming from each side and then 1 in the back. The 2 on the sides were removed yesterday. Again, painless. The 1 in the back of my neck will be removed on Monday, the day before I leave to go back home to Texas. What all did I get done? I obviously had a neck and facelift. He removed almost 2.5 inches of skin off my neck and about 1.5 inches skin off my face. I did the upper and lower blephs. You can kind of see those. You can see the stitching. All that will be removed before I go home. He did an upper tail brow lift because one of my eyebrows would go up higher than the other. So he kind of straightened that out a little bit. He did a deep plane facelift. Let me clarify that. It's deep plane. Look it up. There is a difference. Deep plane is a little more intricate with better long-lasting results. He did fat injections into my cheeks, into my lips, and into my chin. He harvested the fat from my neck to do the implants. What else? How much was I quoted in Texas? Too much. I think the cheapest quote I got was over 40 grand, and that wasn't even for a deep plane, and it was not for near the care that I get here. So, and why didn't I do the lip flip thing right here? Basically because my surgeon didn't think I needed it. So I was happy with that. I really didn't want that scar, but he knew best. And so if he said I didn't need it, then sis, I ain't gonna get it.
Ellie is here. She is 5 days after her surgery and she came in today for drain removal. Not everybody's drain come out the next day or 2 days later. Some people drained quite a bit. I'm glad we kept it in for those period of time so she had no bruises here. What I did for her is called vertical lift, which included extended deep plane face and neck lift and temporal brow lift. Then I did CO2 laser of whole face, and as you can see, these are the temporal brow lifts endoscopically, and these are the incisions for the deep plane face and neck lift.
I look at the photos now and I feel like I look at least 10 years younger. I feel like I'm in my 40s. I just turned 60 a month ago, but I feel like I look late 40s, easily late 40s.
This patient is only 36 years old. I normally don't do surgery on 36-year-olds, but they're exception to the rule. She has hereditary issue that gives that fullness in the neck and jowl and the sagging of the brows. I did a deep plane neck lifting, a mini facelift here, temporal brow lift. Her neck is well contoured, doesn't have that fullness anymore, and I'm very happy for her. We got Trish here. She had her surgery 1 week ago. She had preservation, deep plane face and neck lift, temporal brow lift, lip lift, and lower eyelid surgery or lower blepharoplasty, and full face laser. That's why she's a little red. But it's amazing how fast she has healed. These are the incisions. You barely can see them already. Her neck looks like a 35-year-old neck. We have done Elixir MD, blue light, detox, hyperbaric oxygenation, and also yellow light therapy. She's doing amazing well, and I'm very happy with her results.
All in all, do your research, consult with a qualified surgeon, and most importantly, please make sure you're doing it just for yourself and not because of what society says you should do. After all, aging is indeed a privilege, and so is feeling comfortable in your skin with all the wrinkles. Embrace them to the fullest. Aging is normal.